Good afternoon, dear colleagues. Thank you for having me here. And I would like to start with a question that challenges our perception of facial rejuvenation with absorbable threats. Are we truly correcting age-related signs, or are we merely reposition the tissues? For too long, our focus in thread-related aesthetics has been primarily mechanical, lifting, pulling, suspending. But what if we could move beyond lifting? What if we could improve the underlying tissue biology? And today, we are here to unveil a new paradigm, a new technology that does exactly that. So, as you know, the aging phase is not a singular event, but a symphony of degenerative changes throughout multiple anatomical layers. First, skin laxity and tissue descent, then textural deterioration and loss of dermal firmness. All of these processes accelerated by collagen and elastin degradation, and also reduction in endogenous hyaluronic acid. That means that comprehensive age-related correction must address all these factors simultaneously. So, while traditional barb threads are excellent for mechanical repositioning and lifting, they present a significant texture gap. Their biological impact on tissue is very low. This often requires complementary injectable in order to address all the signs. On the other hand, we have native hyaluronic acid. It's a powerhouse of biostimulation. But its Achilles heel is very rapid clearance. So this brings us to the core of today's discussion, the technological breakthrough, new generation of PCL-PLA HA threads. At its heart, we have a robust PCL-PLA monofilament structural core, which offers superior tensile stretch and elasticity. All of you knows this kind of polymer. And it also offers controlled, long-lasting resorption of the thread up to 24 months. But the true innovation is in HA, native HA, encapsulated through a sophisticated technology into micro, submicro, and nano capsules, each of them playing a distinct role. So how does this encapsulation work? Actually, think about this device like a slow-release medication, a microscopic medication. The PCL-PLA copolymer shell acts as enzymatic shield protecting native HA inside from hyaluronidase. So this isolation is crucial. It prevents the rapid washout of HA and in the same time leads to the progressive slow release of HA throughout 6 months. So I think it's a very important fact since we provide in this way sustainable bioavailability of HA for a long period. So we sustain fibroblast, as you know. So this final result is that we have the synergy of mechanical support and biological revitalization. And this process is multi-phase. This is the core of innovation. So the phase number 1, which lasts approximately 1 month, the capsules with thinner walls, I mean, they are so thin that the release of the HA is immediate, right after the thread insertion. So the tissue get hydration, setting the optimal stage for healing and also thread integration. And this is very important from the clinical point of view, and you will see why. Phase number 2, 1 to 3 months, in which period we create collagen stimulation, not only but releasing HA, but also strengthening the dermal matrix during this critical period. And in the end, the nanocapsules, the capsules with a thicker shield, release HA very long period of time, up to 6 months. In this way, we create a maintained bioactive activity of HA. So it's a really game changer in sustained tissue regeneration. And you can also see in this graph, the upper line corresponds to this new thread generation with HA encapsulating, which provide very sustained, prolonged HA, native HA, remember. The lower line corresponds to the previous thread generation coated superficially with HA. And look at the lowest line. This is interesting. This is native HA injectable, so just few days of activity. So this clinical evidence is built upon 2 robust studies. One of them split phase comparative bioefficacy evaluation, and another one long 12 months longitudinal performance. So what we see from these studies, first of all, you see superior skin quality result. Look, right after 1 month after the insertion of thread, we see up to 150% of wrinkle reduction. But it's not only a question of wrinkles, it's also a question of texture evenness, pore refinement, and pigmentation. And what about lifting? And you can immediately see that these new generation threads deliver the same reliable mechanical reposition that the previous. So, but if you look to the high performance, I mean high level lift, more than 1.5 millimeter, more than 2.5 millimeter, you see this new thread shows a clear dominance. But it's not just question of barbs, it's question of biological synergy. The integrated HA driven the tissue, driven regeneration, act as biological scaffold, so redensifying a dermal matrix and preventing tissue descent, so making the anchoring much stronger. So what about safety profile, our first question? And we see dramatic improvement in all parameters: swelling, discomfort, redness. What does it mean in practice? It means shorter downtime, quicker return to the social activity, and at the end, and the most important probably, higher patient satisfaction. So, dear colleagues, this new technology signs a paradigm shift in fascial rejuvenation with threads. So from traditional mechanical approach, we move to bioactive revitalization, solid biostimulation, we can call that in this way, and it means mechanical plus biological. And I would like to show you a typical clinical case. I intentionally put 3-day picture, the picture of the patient 3 days after the insertion and 12 months later, just to show how is minimally invasive this treatment. Look, no edema, no swelling, no redness, and the patient does have distortion of her features. In the final image, you see that the effect of this treatment probably already lower. We still see some good result. However, we often forget one important thing, that during this year, our patient aged by 12 months. And this is never considered when we look at the pictures before and after. So our assessment at the end, it's not so correct. That's why, like 1 year ago, I have introduced into my practice a new AI-powered platform to evaluate the features of the patient using 3 indexes: facial aesthetic index, evaluating overall attractiveness, facial usefulness index, which evaluates perceived usefulness, how young our patient, and skin quality index. And using the platform, look at the result of this patient. So we see 3 indexes, and in fact, from baseline, our patient facial aesthetic index jump from 68 right after 3 days at 77. And look, after 12 months, it's even better. You say, how it's possible? Because the patient seems to go back at her baseline. The parallel gain for usefulness index and also for skin quality index. It seems not so normal, but here is the key methodological point. At every time point, the patient is compared against data for individuals of her gender, age, and ethnicity. It means when we see these indexes moving up, it means that the patient aesthetic, all these indexes, starting going toward optimal presentation compared to the average of the population. So it means in time, a longitudinal way, we can observe improvement of her parameters. And I think it's really important. Here we can see the graph which reproduces the same. And another interesting characteristic of this software is that we can also see potential for further improvement. And you know how it's important when we are consulting our patients to talk about further treatments or how to maintain the result. So I think this kind of new technology, and I come back to threads right now, have different advantages for us as practitioners. So superior skin quality, enhanced lifting, optimized recovery, proven durability. And all of this thanks to this bioactive synergy. So we prepare the tissue during our procedure, and we have synergy between biology and mechanics. So in final synthesis, what we are witnessing today is a true paradigm shift from mere mechanical lifting to meaningful biological tissue regeneration. And by the way, this is the trend of all other technologies today. I am very happy because I have been doing this from the beginning of my professional career. Thank you very much for your attention, and I'm ready for questions. Thank you.
Thanks so much for the lecture and for the new way to measure the results of the treatment. Our second speaker is Professor Tanya Tejapichan-Banich, and she is from Thailand. And Professor will talk about refining static line with multi-zone thread applications. Thank you so much.
So thank you for the kind introductions. Is there anyone using volumization thread in this room? Have you prefer filler or volumization thread? Okay, so I think it is depend on the anatomical location, which I would like to tell you for my lectures. Okay, this is a classification and type of the thread. So first thing first, if you want to lift the tissue, you need the thread that have drawn, or we call barb thread or cork thread. But however, there is another type of the thread that you can volumization or improve the skin textures. If you remember like 10 years ago, we used the mono thread and we inject it in multiple monothread into the skin in order to stimulate the collagen. But however, when time passes by, there is the development of the thread. So you can see that they use monothread and then they bundle together to form a configuration, right? You can see that it looks like a broom, we call it like a monofilament, or it may look like a spiral or even a mesh. So beforehand, if you want to lift something, you need to have thread that have thrown, which is the cock thread. So there is the forward cock and reverse cock in different directions. So if you pull the thread in this direction, the forward cock will pull the tissue up, while the backward cock will prevent the tissue not to go down. So at the end, you can see that you will get the bunching in the center. But however, this one is not for the volumizations. And can you see that this is the volumization thread? So there is the two benefits. The first one you can use for collagen stimulations. Another one, if you have the depression, you can use the volumization thread to fill in the depression. There is two techniques. The first technique we call direct elevation. It means if you have the depression, you can insert the thread parallel to the depression as it's going to be like lift up. Another technique we call the leverage technique. It means sometimes you have the depression that going to have like infold, like folded. For example, in the glabellar area, the upper surface will be like folded inside. So that is why you can use another technique called leverage technique. So you use the direct elevation first, and then you use the leverage technique by put the thread perpendicular to the first thread like this. So it's going to be like lift up in the deeper. So you can use two techniques for the folded skin. And this is the thread that I usually prefer is spring thread. First thing first, it has a high surface area. So you can attack all the surface of the thread and stimulate the collagen like fibroblast stimulations. And it also had the hollow interior inside. So that is why when you place the thread, it's going to be like volumized instantly. But this is very important. This is the indication that you use volumization thread, because I also use the filler, right? So the first thing first is the area that you need subtle volume. For example, under eye area. So sometimes in Asian, we cannot withstand imperfection. So when I inject the filler under eye, it still have the superficial area left over. So that is why in that case, I put the volumization thread. Because if I inject the filler in the very superficial plane above the orbiculate oculi muscle, what happens is they're going to have Tyndall effect, right? So that is why in that case, I use the volumization thread in the area that I want subtle volume. The second is the wrinkle for the ligament tension. For some time, the Indian band or nasolabial fold in this area. So I try to inject the fillers, but it's going to be left over the depression area because the ligament, the tightening and the density of the ligament is different in individual. So that is why sometimes I try to inject the filler, but it still has the depression because tightening the ligament. So that is why in that case, I use the volumization thread. The high motion area, especially in the nasolabial fold, sometimes you use the filler, but it can like move into the lateral area. So I will use the volumization thread. Lastly, I think very important, and it is the indication that I use a lot. It is the area that you need to be careful of the vascular complication with the filler. For example, the glabellar line and also the forehead line. So as you can see that there is the artery and also the vessel that rarely mentioned in the textbook. So you can see this one. So this one is intercanthal vein, which can connect with the cavernous sinus. And this one is central and paracentral artery, which also can connect with the dorsal nasal artery and get blindness. So that is why if you want to fill up with the fillers, because they will have the static line that you cannot correct with the toxin, and you want to correct with the filler, no. So in this area, I use the volumization thread instead in the 11 line here, and also in the forehead line, I also use the volumization thread. This is the area that you can utilize the volumization thread, the glabellar area, the supraorbital depression, especially in male patients. You may have male patient and then they come to you that, doctor, I have the supraorbital rid here. Can you like fill me with the fillers? I think it's very important because in this area, the vessel is going to change plane. So it runs deep and then going superficially. But in this area, it's going deep like a before it change plane. So that is why if you put the filler in this area, it can create the complications. And this is, I think it's quite a simple procedure, so I would like to show you. So this patient, case number 1, the patient has infraorbital hollowness. You can see that she has very thin skin here and also poor elasticity. And if you put the filler into her, what happens is it's going to be protruding and maybe create the Tyndall effect. So in this patient, I put the volumization thread. I will show the video. So I decided this is an infraorbital rim here, and this is the mid-cheek group here, and this is a no-go zone because it's the nasolabial fat pad, so you don't want to volumization in this area. And this is the line in between the lateral canthus. And I draw the line here. This is the first entry point of the volumization thread. So I entry in the superficial plane above the orbiculi muscle. Actually, you can inject the filler in the deep plane, but cannot in the superficial plane. And then I do the leverage technique. You can see the parallel, and also, this is parallel to the mid-cheek group, and this is the perpendicular to the mid-cheek group in order to lift everything. And this is in the nasolabial fold as well. This is for the localized anesthesias. It's very easy. You can do in the clinic. And then this is the 2018 gauge needle because that is the different size. So you can put different size of the thread. This is the smallest size, 27, and you can see that I use the non-dominant finger to advance the thread in, and you just remove the cannula and then remove the guide tube, and the thread will be embedded inside. And because it's spring test, so it's like forgivable. So if you measure around distance from the distal end, you can also push it a little bit because it's spring, so it will stay there without protruding. So you can do like 2 or 3 thread here. And then for the mid-cheek group or nasojugal group, you can also do leverage technique. So I do the parallel to the group and also perpendicular to the group. This is the medium size, around 23 gauge thread, like cannula. So it's very easy. I haven't fast forward the video because I want you to see that it's just only like short time for doing the procedure. Actually, in my video, usually I fast forward video because there is no time, but I really want you to see the real procedure. So you can put so I put 2 threads here and also 2 threads in the leverage technique. And lastly, at the nasolabial fold, you can use the bigger thread. Bigger size is 21 gauge cannula. I think all of the procedure is maybe 5 minutes, 4 minutes, and then you're done in your clinic. See? This is just only 2 threads here in the nasolabial fold. Very easy. You can use your non-dominant finger to put in the subcutaneous plane. And lastly, I put into the subzygoma area as well. So this one, because it is a PDO thread, is going to be dissolved in around like 3 months. And after that, there's going to be the collagen stimulation, and the face of the patient will be lifting. Okay, you can see like before and after. This is the half side, and this is the non-treated side. You can see the difference in between 2 sides. I would like to show the picture here. You can see that this is after complete the procedure, before and immediately after. Another patient is very important because the patient have the glabellar depression. So in this case, I also use the volumization thread as well. Actually, I have been using filler before, but I got 1 case complication with the filler necrosis, so I'm done. So after that, I use the volumization thread. Even though I know anatomy very well, I'm like running the cadaver course in many courses, but one time I did it. So from now on, I use the volumization thread. So it's very easy. You can coming from the forehead area and fill in the depression. And I use the leverage technique as well. With this is the parallel, right? And then I come from here, like lateral, and insert perpendicular to the lines. So it's going to be lift up in the deeper plane. This is a direct technique. You can put the guide tube and then remove the cannula like this. And this is the leverage technique. So coming from perpendicular to the line, just only do the local anesthesia and then you can move the thread. So the plane is subcutaneous plane above the frontalis muscle. Okay, because I have like really little time, so I will skip, and then you can see immediate. You can see it's improved 50%, and 1 week that is like no downtime. It's very, very nice. And you can see baseline and 1 week after, and you can see volumization at the glabellar line by the quantifier. And this is case number 3. I won't show the video, but the patient has forehead line, which is very danger for injection the filler in the very superficial plane. This is static line. So this is my design. So I do the direct elevation technique by putting the volumization thread along the line and leverage technique. So this is after, immediately after, you can see improvement. So thank you very much.
Thank you so much. Very, very interesting results. Our next speaker is Dr. Mustafa Tansel Turan from Turkey, and he will talk about a case of hypertension due to iatrogenic glossopharyngeal neuropathy after a thread lift procedure.
Thank you. Ladies, gentlemen, my dear colleagues, good afternoon to everybody. I'm very happy and I'm very honored to be here in this lovely city, in this lovely country, and with you wonderful people. Before my presentation, I wish a happy Father's Day to all gentlemen. Today we are talking about something about the complication about the thread lifting. You know, thread lifting, PDO, PLA, PCL, and combination thread systems has become one of the fastest growing segments in the field of medical aesthetic over the past 10 years. There has been significant demand, particularly among patients also do not want a surgical facelift, are looking for a shorter recovery time, and wish to benefit from the biostimulation effect. If we look to the sector, the thread lift market will grow at an annual rate 6 to 13%. It will grow faster than the surgical facelift market. The greatest growth will occur in the Asia-Pacific region. Turkey, South Korea, and Brazil will strengthen their roles as training and application centers. PDO alone will not be the focus. The combination of biostimulation and lifting will be take center stage. Thread techniques utilization with AI-powered facial analysis and vector planning will be the trend of the new era. In a global perspective, global demand for minimally invasive lifting continue to rise. Thread lift vectors converge around the critical facial and neck anatomy. Safety depends on respecting depth, direction, and traction. In practice, although we all cause minor or minor complications in our practice. But unfortunately, tend to take them for the granted and not pay attention to all of them. Often we dismiss it will excuses like it's just swelling, it will pass, or it's just an hematome, it will resolve, or the patient has a low pain threshold. However, all these minor or major symptoms are very valuable for us. Today, I want to share with you a patient experience that might otherwise be overlooked. The patient's initial treatment wasn't my responsibility, but they were referred to me by consultation by a careful physician. It's 22 years old female patient. They do bilateral jaw and submental suspension to the patient, sudden throat and tongue root pain during the left-sided procedure, immediate bradycardia, hypotension, and pre-syncope. Persistent dysphagia and tonsillar pain, referred otalgia and near syncope episodes, blood pressure shifted from normal to hypertension range, initially treated as a presumed essential hypertension. Why we are thinking about the cervical nerve 9 and why did it come to our minds? Because oropharyngeal sensory deficit, posterior third tongue test disturbance, and xerotomy and localized tonsillar pain. After this, we thought about it will be the cervical nerve 9 problem. And after MRI, we see the edema near posterior and inferior parotid region. If you look anatomical trap, glossopharyngeal nerve, deep parapharyngeal course, close relationship with carotid sinus and vagal pathways, blind cannula path, excessive traction can compress the neutral structures, mandibular jaw vectors require a precise deep depth control. A baroreflex story will be occur here. At phase 1, acute compression, access efferent firing, bradycardia and hypotension because of vagal activation. At phase 2, neuropathy, loss of baroreflex buffering, sympathetic dominance, and sustained hypertension. Red flags after thread lift, if you see dysphagia or throat root pain, referred ear pain, posterior tongue numbness or taste loss, presyncope, bradycardia, hypotension or hypertension are the red flags of us. Neurology consultation, ENT consultation and MRI evaluation, surgical exploration and removal of threads, symptoms improve within 20 days after this. Of course, cervical nerve 9 is not unique area at risk in thread lifting procedures. For example, I saw 2 different patients who were referred for consultation after this case. One of these was persistent severe pain due to the grand auricular nerve edema, and the other one is the deviation of the mount due to compression of buccal branch of the facial nerve. We have so many nerves, we see so many nerves and arteries in face, so every point will be very dangerous. Some of them are not are persistent. So it is an important point. Presentation principles, plan vector, plane depth, and fixation point before insertion. Avoid aggressive traction near mandibular and cervical danger zone. Stop immediately when pain pattern is atypical. Teach complication anatomy, not only lifting techniques. Future of safe aesthetic medicine, ultrasound-guided fascial procedures, functional anatomy training for injectors and training thread specialists, complication-oriented algorithma, multidisciplinary care, aesthetics, neurology, ENT, and radiology. One thread, one nerve, one systemic complication. Thank you for your attention.
Thank you so much. It's always good to also speak about complications, not only the good results. And our last speaker is Dr. Hoo-Rang Kim from South Korea. And Dr. Kim will talk about undyed PDO thread for thread lifting in patients with thin skin.
Good afternoon, ladies and gentlemen. I'm so pleased to be here. I'm Ram Kim from my plastic surgery clinic, Korea. Today, I'd like to talk about a very interesting topic, undyed PDO. Well, actually, this presentation is supported by a company. So, I've performed thread lifting for more than 20 years, but still, I believe that my procedure was quite good, but sometimes my patients, especially if they have a thin skin, they will complain of several problems like palpable thread, foreign body sensation under skin, or contour visibilities. So strictly speaking, a lot of physicians like me have focused on to develop the thread in terms of lifting power, thread longevity, collagen stimulation, and absorption profile. But frankly speaking, we have neglected the importance of thread palpability, foreign body sensation, contour visibilities, especially for the patient who has thin skin. The patients usually have elderly patients over 55 years old. If they have low BMI and their skin and soft tissue coverage is very thin, so it's very difficult to treat with the thread. So some physicians treat this patient as a contraindication for lifting thread. I also made several mistakes with the thread to treat with thin-skinned or thin soft tissue patient. Sometimes I commit some dimpling or contour visibilities like this. To solve this problem, I'd like to start with the material first. Usually, we are using PDO thread frequently, which is blue, but originally, the material PDO is not blue. Actually, it's translucent or white. But this thread is used for the surgical suture to distinguish from the bloody surgical field. They add dye on it. It's called DNC violet number 2. That's why nowadays the color of PDO is blue. But this pigment can act as a nucleus. Around it, the polymer can be aggregated to be crystallized. That's why after time, the thread becomes stiffer. So the original PDO thread itself is much softer than the blue one. And this pigment can be also released during hydrolysis, which can cause inflammatory response. So some sensitive patients can feel discomfort with it. Shortly speaking, blue PDO thread has stiffer and slightly inflammatory than that of original PDO. What is interesting is that usually there are chemical company and there are thread processing company are separated. In the shoe of thread company, they should get the raw material with low price. That's why they are using blue PDO for lifting thread. But if they are the same company, they can modulate the amount of the inventory, so they can also make undyed PDO with reasonable price. Yeah, shortly speaking, dyed PDO with DNC violet dye, which is stiffer. Because of the stiffness, the tissue conformity is lower than the original one, and it also has a higher risk of contour visibilities. I tried to show the difference with these two threads. This is blue one, and this is undyed PDO, softer. So when we treat thin-skinned patient with the thread, the two is very complicated. We should change the design. We should reduce the number of thread what we use. Coat type should be considered. The thread thickness should be thinner, and the layers should be deeper. And then additionally, from now on, we can consider the material again. If we use undyed PDO for this patient, you can reduce the probability of side effect. I applied these two types of PDO into silicone gel sheet. These sheets are as thick as 7 millimeters thick. As we can observe, if we applied the thread into thin-skinned patient, the color and contour of this thread can be easily observed on the surface. Furthermore, if we treat the patient who has a thin, soft tissue coverage, which can include not only the skin, but also subcutaneous layer, muscle, and other ligaments, so it's also very challenging. So to treat this patient, I do believe that the undyed PDO is very useful, so I planned a split study. First of all, I choose thin, soft tissue coverage patient. Then I applied on the left side dyed PDO, on the right side undyed PDO. Actually, these two threads is manufactured with the same manner by a company, and I used the two types of the thread. The first one, bidirectional cogged thread. This thread is used for the reinsertion technique. I'd like to shortly explain how I apply the thread. Bidirectional one, you can insert the cannula into the skin and remove the cannula. If you pull the exposed part of the thread a little bit more, the tissue will be contracted, and the middle portion of the tissue will be contracted and protruded a little bit. But you can cut off the exposed part. But instead, for this time, I will reinsert that exposed part into the skin again, and I advance it to another direction. That's reinsertion technique. But additionally, I also used fixed type thread. Actually, the drooping created by the gravity can be easily released if you lay down the patient. It can be easily neutralized. In that case, if you apply the fixation type thread, it's a kind of lifting. So I prefer to apply this kind of fixation type thread, which is also called embossed cogged thread. With this thread, I applied the insertion and cutoff technique. I usually insert the thread from the lateral side of the face and advance it to the medial side. On the right side, I applied undyed PDO thread. From the inserting point around the tragus, I insert undyed thread through subcutaneous layer to the lateral part of the marionette line. Then I reinsert the thread advanced to the temporal area to correct marionette line. Additionally, I insert two more threads from the side band to the lateral side of the nasolabial fold and reinsert the thread and advance it to the temporal area as well. So furthermore, I also use fixation type thread. For this time, I used down to up technique. I make 2 inserting points just above the lateral cheek hollow, not to aggravate that anatomical depression. And I also make 2 more inserting points on the mandible margin. This is undyed PDO fixation type thread, emboss cold thread. I insert the thread, advance it through subcutaneous layer, and cut off exposed part. Once the thread is exposed to the tissue, it's already fixed that even though you pull the thread anymore, it will not move at all. I also insert 2 more threads from the mandible margin and advance it to the medial lateral canthus, and 2 more threads to the temporal area. On the right side, I applied PDO thread. But strictly speaking, the purpose of this study is not the effect, but reducing the complication. So I asked the patient about the foreign body sensation. I also tried to find out the contour visibility after a week. So before and after the procedure, it's also the same. I usually choose the thin-skinned patient. So the aesthetic effect was almost the same, but the foreign body sensation scale for delayed PDO was 3.8, relatively high, but with undyed PDO, it was just 2.0. So the patient, the side where I treat with undyed PDO, the patient feels more comfortable. And I can also find out contour visibility, 3 cases with dyed PDO, 1 case is with undyed PDO. So shortly speaking, even though there's some limitation, I choose 15 patients. The size of the sample is quite small, and I didn't perform the histological data, but I also find out that it can give us some probability if we treat undyed PDO to treat the thin soft tissue patient with undyed PDO. It must be very useful to reduce the side effect. So in my case, I usually applied undyed PDO for this kind of patient. Elderly patient who has thin skin, low BMI, and their soft tissue coverage is not sufficient. And then the special area like the thickness of soft tissue is very thin, I can apply undyed PDO as well. So for this patient, it's easy to correct because the weight of their soft tissue is really light. So you can lift up with the usual thread, it's very simple, but it will create some kinds of discomfort, foreign body sensation, contour abnormality. But if you treat this patient with a softer thread like undyed PDO, you can reduce the side effect and you can satisfy your patient more. Additionally, so we can also correct the upper eyelid drooping with the thread, which is also called Paxi eye procedure. We can insert the thread just beneath the eyebrow. But as we know, the thickness of the tissue on forehead is very thin, and it's mobile part. So a lot of patients will complain of pain or discomfort when we apply thread on forehead. Instead, if we apply undyed PDO on this area, you can reduce the probability of side effect. So I used undyed PDO for the patient who has a very thin skin and soft tissue. And I also applied this kind of soft thread to treat patients on very superficial or thin tissued area. This is the end of my presentation. Thank you very much.
Thank you very much. And we have time for some questions, comments from the audience. We also are live if there is a question on the app.
For you, Tanya, is it easy to remove if you have any complication?
Usually it's very less complication, but if there are complications such as you try to insert the thread but it's still protruding, you can just really use the forceps and remove it because it has no barb. Yeah, very easy.
But maybe you can track some therapeutic tissue, no? Because you have a circle.
Again, please.
You can retract some therapeutic tissue if you have to remove, maybe not immediately after, but maybe after 3 weeks or 2 months, your product, it will be integrated in your tissue. So if you have some trouble for tears or so, this is not so easy, no?
You need to, no, because, but it's PDO thread, so you need to like leave it until it, is gone, it's dissolved. But however, usually this is very important that you need to follow up your patients like 1 week after. That is the key, because if there is collagen stimulation, it's very difficult to do anything. So it's going to be like scar. Or I think it would apply to any thread. Yeah.
For all users of threads who use echo guidance, because my colleague from Turkey said we can use echo guidance to maybe reduce some complication, and for the follow-up to use ultrasonography for the ultrasound to follow for the follow-up.
No. Yeah, no, I never use it.
Regularly. Who put threads? Who put threads here? You, 2%, 3, 4, 5. Who use ultrasonography to check? 2. Because sometimes for nasolabial fold, you are unlucky, and if you have a facial branch at 3 with a loop, if you don't check with ultrasonography, you can maybe introduce your needle on your thread into the facial branch. Never?
Into nasolabial fold.
Yes, when you inject.
I always add the subcutaneous plane.
Yes, but sometimes you have the facial branch, they make a loop, and they go more superficially. And it could happen when you inject fillers, but it could also happen when you inject a long needle, and you can introduce. Never happen? Never. You are lucky. Yeah, agree or not?
Yes, I agree.
Okay, be aware.
In future, maybe everybody need to use ultrasonography and other check methods for the threats, because every day the complications that we see are larger. At the first time, last times, we know only hematoma and such as simple complications, but nowadays we see much more complications.
Okay, I encourage you for the future, when you make a presentation on threads, to put some slide with ultrasound imaging before, after, and for the follow-up. Because, I receive a lot of patients in my clinic, and they are unhappy by threads. And for many reasons. The first is for complication. The second, because they don't see any result. And the third, I can count the number of threads they have below the face. And sometimes patients are talking to me and say, your colleague put me a lot of threads. Okay, I put my dress on and I see nothing. Where is the threads? So for the follow-up, because you say you are integrate, and this could be very interesting because you cannot make a biopsy to prove that you induce some collagen, remodeling, many things. But with a new image with a high frequency like 22, it's not unnecessary. You can stay very superficially, and you can maybe calculate the thickness of the epidermis, the dermis, or maybe to see the integration for the future. Because I see a lot of beautiful picture before and immediately after. Yes, but it could be an edema, and you will see some lifting effect. So prove to me that you have an effect with a long follow-up, okay? Because we see so many patients with how they are unhappy about that. So it's just my advice. I don't know if you want, but I see that my colleague use ultrasonography, and it's not so difficult, you know, because I'm very fan of ultrasonography, as you know, okay?
Any other comments, questions?
Okay, we have to leave because we are chair in another session. And maybe the next will be on laser, the newest, the update. You are the chair? Who is the chair for the next session? Who are the chair? Nobody? No question? Oh, you can follow me. Huh? I'm chair for the intelligence artificial, huh, if you want. But really, who are the next chair? On the beach? Tanya, you want to take the seat? Next session. So, thanks, my dear colleagues, for your presentation. For my colleague from Turkey, for your presentation. Irina left. And for Tanya, professor in Thailand. Okay, thanks a lot.